And we are really delighted that today we have Professor David Hui of Chinese University of Hong Kong with us to answer more questions and to talk about some of the latest update. But before we get started with Professor Hui, wanted to give you some update here in Hong Kong. As of yesterday, the government has shut down karaoke parlor, lounges and mahjong parlor, karaoke clubs and nightclubs. A drastic move finally the government made yesterday. And also earlier in the week, or late last week, about Friday, we received notice considering Asia Society Hong Kong to close. So Asia Society Hong Kong now, the center is closed to the public for 2 weeks until Easter holiday. Hopefully we'll reopen Easter Sunday if all goes well. But again, we will wait for more updates from the government. On the U.S. side or global side, I think right now the top three countries with death rate higher than China has been Italy, Spain, and the United States. And right now, it seems to me the epicenter continues in the United States to be in New York. And we will hear some, for information about some of the COVID-19 updates and information, Asia Society New York is also been doing a series of programs like this, and so please stay tuned with asiasociety.org for information about more COVID-19 live webcasts or programs so that you can keep up to date on the global development. But today, we're delighted that Professor Hui is with us, and he is a man who's quite famous here in Hong Kong these days because we almost every day I hear quotes from in the newspaper by Dr. Hui because he's a chief advisor, one of the advisors to the government, to the chief executive, and Professor Hui graduated from the University of New South Wales in 1985, and he then was trained as a respiratory medicine and sleep medicine in Sydney, Australia. And in fact, tonight he will be speaking to Australian television. So we're delighted that Professor David S.C. Hui, Chairman, Department of Medicine and Therapeutics, Chinese University of Hong Kong, is with us this morning. Professor Hui, thank you for being with us. And we have decided to distance ourselves rather than doing this 1 hour long webcast wearing a mask because it's really uncomfortable and the weather it really heats up. So we're delighted that we can see Professor Hui in person today without the mask, but we ourselves are distancing so that we can bring you this program. So before, I would like to get your summary from your perspective here in Hong Kong. The latest development. You have been following this case of COVID-19 from day one. And tell us, when did you first heard about it in your capacity? And also kind of tell us also the update of the latest situation as of today, April 2nd.
Well, initially I actually heard about the atypical pneumonia, unusual pneumonia from the media around end of December, right? And then it was related to a seafood market in Wuhan. And then 1st of January, the market was shut. And then they found a brand new virus on the 7th of January. Yeah. And then the first case actually spread to Hong Kong around middle of January from visitors from Wuhan who came to visit their relatives and friends in Hong Kong. So the first 10 cases in Hong Kong actually were imported from Wuhan. And then that actually led to some local outbreaks. Most of the cases we could trace the contact source, but there were actually some cases that we were unable to identify the sources. So at that point, it sparked a bit of anxiety. But fortunately, that actually died down. Yeah. And then from March, we have a lot of Hong Kong citizens who returned from Europe, North America, and there were also some tour members who returned from Egypt and India. And some of them actually took the virus to Hong Kong. So at the moment, we have, before the 18th of March, we had about 200 cases in Hong Kong. And after that, it jumped up to more than 700 now. And about 2/3 of the recent cases actually have been imported. The other 1/3 is due to some local outbreaks. Yeah. So at the moment, we are actually seeing an increasing in the number, quite a sharp rise in the number. which is causing a bit of concern.
And you, in your capacity as advisor to the Hong Kong government, I remember last week hearing about possible restaurant closures or pubs not serving alcohol and so on and so forth. So you have been advising the Hong Kong government. What are some of the things that you are looking at in terms of signs that we are out of this surge, or are there particular things that you're because yesterday, as I recall reading in the newspaper, there was also talk of turning one of the sports park, some of the possible surge up to 2,000. Is that something you're concerned about, that the number getting as high? We're not yet 800, but is that something? What are some of the signs you're looking at right now?
Now, at the moment, most of the cases have been imported. But that has also resulted in some local clusters. Some of the clusters we could trace the source, but there are also a few clusters that we cannot identify the sources. Now, if the number of unknown clusters keep on growing, resulting in more and more cases in the community, then we have to be prepared to prepare other venue, because that would overwhelm the healthcare systems. At the moment, the hospital isolation beds have been used almost to the full capacity. And recently, the hospital authority, they actually have refurbished the general wards, improving the air ventilation, creating negative pressure. So they have some, like 400 beds under negative pressure that can accommodate patients who are actually on demand, and yet they are still positive, right? But they have too well to be in the tier 1 isolation rooms. But there are only 400. If the number continue to increase, we have to prepare other venues to accommodate these people who are actually getting better and yet not ready to go home. So the government actually has decided to use public housing estate near Sha Tin, because there are actually several blocks that are not yet occupied. So at the moment, the government is using 1,600 units to accommodate the close contacts, but they can actually open other blocks to accommodate patients who are actually recovering. They can use up to about 4,000 units, Yeah. Now, if we see, unfortunately, a major outbreak with a massive increase in number, then we have to explore other venue. So one of the venue would be the Asia Expo near the airport. That is a big exhibition hall venue that we can actually convert into a temporary hospital to deal with the recovering patients and also maybe patients with very mild illness. This is what UK, Spain, Italy, and several other countries are doing at the moment.
I see. So it is just kind of a holding. It's not really for, it is for, I guess, some of the patients who are recovering. So it is something that we're kind of waiting it out in some ways in these temporary.
Yeah, we want to reserve the hospital beds for those who are sick and ill, because some of them may require supplemental oxygen or even transfer to the intensive care for treatment. So the very mild cases or cases that are recovering, they may be transferred to another venues. They don't require very intensive monitoring, and we just have to wait till 2 of their respiratory tract specimens turning negative before we can safely send them home.
I see. And one of the questions I've been, reading about is really the asymptomatic patients. There are cases of them. There are actually not that many. But are you worried about the asymptomatic patients because they're so mild? Their symptoms are so mild, infecting some of the kind of contributing to the community transmission. Or is that something you're looking out for as well?
Yes, indeed, there is actually published data on this issue. There's a letter to JAMA, the Journal of American Medical Association, describing a 20-year-old lady from Wuhan who went to Anyang to visit her relatives. She had no symptoms. And yet, after visiting the relatives, 5 relatives actually got symptoms. And then the whole group were tested. And this 20-year-old lady who had no symptom tested positive, and so were the other 5. But the other relatives, they all developed symptoms. So this is actually very clear evidence that even those so-called asymptomatic carrier can actually infect others. And then there's another letter to the New England Journal about 1 month ago. A lady from Shanghai went to Germany for a conference. And during the meeting, she had minimal symptoms. But 2 German colleagues actually were infected. And one of the German colleagues actually infected his children and son and daughter, so resulting in secondary transmission. So there are good data showing that asymptomatic infection or mild infection can actually infect others. And we now know that when someone actually got infected with COVID-19 or SARS-CoV-2, the viral load actually would go very high, very early, on day 2, 3 of the symptoms, after symptom onset. So that is why there is a lot of transmission in the community, especially among the close contacts. And in Hong Kong, we have actually looked at the percentage of asymptomatic people. Recently, the Department of Health actually offer free testing to people who return from Europe and also North America. And so far, 1% tested positive. They had no symptoms. 1%. 1%, yeah, they had no symptoms. But if you let them go around in the community, they can certainly lead to community outbreaks. And we have also looked at the first 600 confirmed cases that have been admitted to the hospital authority. Now, to my surprise, 12% actually are asymptomatic.
So this, in some ways, really justifies the social distancing and what the government is doing in terms of the restaurants being really cautious with the public gathering. And I know in Hong Kong, several weeks ago, we heard about cases in certain restaurant clusters and clubs and musicians also being infected and living together, also infecting. So in some ways, the social distancing. How effective do you think Hong Kong has in practicing the social distancing? Is that the best way to deal with these asymptomatic cases, or is there any alternative that you can see?
Well, there are a number of containment measures that we need to maintain in order to control the spread of the infection in the community. We have been isolating the suspected cases and the confirmed cases in the hospital isolation room as early as possible. We have been quarantining the close contacts in the public housing arranged by the government so that they don't spread the infection into the community. Now, social distancing, as you have pointed out, are also very important measures. So in Hong Kong, school closure has been in place since the end of January, the Chinese New Year holiday. And so far, it has continued. And I think it will continue until the next academic year, most likely. We also, at one stage, introduced remote working. So the civil servants were working at home for quite a number of weeks, and they only returned to work partially on the 2nd of March. And then lately, because of further community outbreaks from the returnees from Europe and North America, some of the service also became wind down, became remote working. We have canceled all the major mass gathering events. For example, the fireworks on the 2nd day of Chinese New Year. And usually you would have about 0.3 million people gathering around the harbor. And that would be disastrous if that had continued. So that was canceled. And we also have canceled the Charter Marathon. That was to be held on the 3rd week of February. Normally, 70,000 people would take part in the Charter Marathon. And about more than 10,000 actually would have come from the mainland. So that was a wise decision to stop all these mass gatherings. And even the religious activity have been scaled down, so they don't have a big church service. And now
a lot of it's online. Right?
Zoom service.
Right. Yeah, Zoom service, yes, that's a good term. But one of the things, and that explains even today, we heard Wimbledon is going to be canceled. And of course, last week we also heard the news about the Tokyo Olympic being postponed till next year. So that explains, these mass gathering could be quite dangerous in terms of transmission, especially among possible asymptomatic COVID-19 carriers. One of the questions now, I want to turn now more to the global side of things and understand what's happening in the rest of the world in terms of the development. In some ways, it's funny, when we started doing this webcast, started in February, it was very much talking about what's happening in Hong Kong and the development. And I remember, people laugh at us for the toilet paper runs and all of that. But I think right now you're seeing some of the spread now, unfortunately, to Italy, Spain, and the U.S. and so on. And then also last week we heard some UK Prime Minister Boris Johnson also is tested positive, and he had originally talked about tackling the virus through the herd immunity angle, but which he's kind of changed his opinion on because right now the numbers in UK are also rising. What are your thoughts on the herd mentality approach? My understanding is right now several countries are still kind of doing that. For example, Holland, as well as Sweden, maybe. So, different countries have different approaches, but it seems to me people now have abandoned or kind of maybe not pursuing what Boris Johnson had originally thought he was going to do for UK. So can you talk about that?
Well, herd immunity approach is to be considered when you have a major, massive outbreak that you don't think containment measures would offer anything. Right? So you surrender, let your community get infected, and then by the time 50-60% of the general population become infected, they would have some antibody protecting them for a while. Okay, now this approach could be dangerous to the high-risk groups. So, namely the elderly, those who have comorbid illness, especially those who have diabetes, existing organ failure, renal failure, liver failure, and even obesity. The people who acquire the infection, they become very ill. They will all need hospital treatment. The number is quite big, and they can actually overwhelm the healthcare system. And also, some of them will die. Okay, and another problem is we don't really know how long the antibody can last. Okay, so you are trying to adopt herd immunity on the assumption that the antibody will protect you for a long period, but we don't know. For example, I can tell you, in SARS, after the end of the outbreak, researchers follow up the patient who have recovered for a number of years, and the antibody only lasted for up to 3 years, and then disappeared. Okay? And for MERS, Middle East Respiratory Syndrome, it was even shorter lasting. It was positive up to 10 to 12 months. And even the most severe case that had required intensive care support, they only had antibody up to about 1.5 years maximum. Most of other patients actually had no more antibody after 10 months. So you can't really rely on so-called immunity, Now for COVID-19, which has only appeared for about 3 months or so, we don't have enough time to perform long-term follow-up, and we don't really know how long the antibody will last. Now, so this sort of approach is hoping that, you let your community infected by, say, 60-70%, and they acquire immunity. And then the other 30% or so can wait for the vaccine, which may become available in 1.5 years, so that they can get the protection. But it's not so simple.
Can we now kind of turn to Italy? I think the numbers there is really striking. I think the mortality rate has been around 1 to 2% generally in China and in Asia, what we've seen. But in Italy, it's around, about 9%. It's quite high. And why is it so much higher in China compared to...
in Italy.
Why is it so much higher in Italy compared to China?
I think Italy, to be honest, was not well prepared for the outbreak. They did not lock down the country early enough. So the infection spread all over the community, resulting in a lot of infection, especially among the elderly subjects with comorbid illness. The hospital system is also overwhelmed. They don't have enough ventilators for the sick patients, and they are using non-invasive ventilator because they run out of invasive ventilator. So I think as a result, when you're not well prepared, your hospital system overwhelmed, this is the consequence. Yeah. So I hope they will actually control it a bit better.
Right now, we're also hearing about the lack of ventilator in the U.S. I know our Asia Society colleague in New York is helping to source ventilators and other equipments that's needed. So it sounds like New York is trying to prepare itself, and you also see the kind of in Central Park. I understand they're getting ready. Temporary, also the comfort ship from on the ship that came into the harbor. So they're preparing themselves. So do you think some of the and then today also reading the difference between approach between California and New York, maybe California prepared it earlier. So what are some of the advice that you would give to some of these other cities that are preparing themselves for this, for the transmission, and really looking at Hong Kong because we're kind of 2 months ahead of the curve?
Well, for the states that are not heavily affected as yet, I would advise them to adopt the containment approach. So you try to test as many people as possible, isolate the suspected case and confirmed case as soon as possible so that they don't spread the infection into the community. You must quarantine the close contacts so that they don't spread the infection. By doing that, you can actually slow down the burn, let it burn slowly so that you can have more time to prepare. Yeah.
And then I think the part of that question, part of it would be the answer is how long do you think the vaccine, I guess containing it, because they're not going to develop the immunity and all that by containing the containment approach. But I guess you're holding them, waiting for the vaccine to be developed. And there are signs that the Chinese government almost everybody's working on it. I wish they would do it more collaboratively and making it faster. But is that something, how long do you think the vaccine, we can see something? You probably are very much aware of the current trials and so on. So if you can give us some information on that, the preparation for the vaccines.
Well, vaccine development usually will take about 1.5 years. To begin with, you need to test in animals, make sure it is effective. And then you need to test in human subjects. There are 4 phases, 1, 2, 3, 4. I think currently in the mainland of China, they are doing phase 1 clinical study. But then by the time the vaccine is ready for production, it will be probably early to middle of 2021. So for the time being, you can only provide either containment measures plus or minus mitigation measures, or your social distancing, to try to delay the spread in the community, to buy time for the vaccine.
And can you, right now, I think there are some lessons to be learned from here in Asia, because again, we're ahead. And yesterday I was watching one of our Asia Society Policy Institute webcasts by Kevin Rudd with Professor Teo from chairman of, I think, NUS, National University in Singapore, talking about Singapore's approach in dealing with this virus, which is slightly different. They have some of the similar measures. So can you, from your perspective, talk a bit about the differences between what Singapore's approach and Hong Kong's approach? The numbers are relatively low compared to the Western countries. I think Hong Kong, as you said, we're around 700, not yet 800. And we have, 7 or 8 million people here in Hong Kong. And in Singapore, their cases are a lot higher, over 900 now, and their population is about almost 5 million. And although, social distancing, some of the similar measures, and there also saw a resurgence of cases when returnees went back to Singapore. So very similar in terms of pattern. But can you kind of, just the approach, I think, for example, the educational, they didn't close schools, but they have other measures. So can you kind of, in your professional opinion, talk about the different approach and the similar approach that Singapore and Hong Kong has taken in tackling this issue?
So both Singapore and Hong Kong have managed SARS outbreaks in 2003, and that sort of experience helps a lot. So Singapore and Hong Kong, they actually have prepared double-door negative pressure isolation rooms after SARS outbreak. So in Singapore, they have a big infectious disease center next to the Tan Tock Seng Hospital that can accommodate, I think, something like 300 patients, right? Now, in Hong Kong, after the outbreak of SARS, the government actually injected a lot of funding to the public hospitals. And in 2005, double-door negative pressure isolation rooms have been installed in every acute public hospital. So there are a total of 1,400 beds that are actually under negative pressure, so that you can manage the highly infectious disease without increasing the risk of transmission to the healthcare workers and other patients. So both Singapore and Hong Kong are quite well prepared in this sort of hardware. And of course, the personnel also have experience handling major outbreaks. So both the healthcare workers in both sides are very experienced with infection control measures, etc. In terms of the community preparedness, I think we have adopted quite a similar approach with containment measures quite early in the outbreaks. All these early isolation, quarantine of close contacts, social distancing, etc. Now, the only difference is in Hong Kong, we closed schools since the end of January. And I believe Singapore did not do so. Now, we believe that if you did not close schools, the children would have picked up the virus quite easily because of the mass gathering in schools. And they would bring the disease home and infect the parents, grandparents, domestic helpers. And that can actually increase the spread into the community. But Singapore has a slightly different approach. I think the school actually they have continued. Yeah, but more or less, other approaches are quite similar. Now, the other difference is in Hong Kong, the local population, they always put on a surgical mask in the public areas and public transport. In Singapore, they don't always do that. Hong Kong is a lot crowded, I can tell you, in Singapore and the Western countries, if someone coughs or sneezes, you probably have room to jump off 3 feet away. In Hong Kong, we have no room. Everywhere is crowded. You are surrounded by a lot of people. So to protect ourselves, we actually put on surgical masks in public transport and crowded areas. And we also pay attention to hand hygiene. And I can tell you that in 2003, the Department of Health actually did a retrospective study comparing the prevalence of respiratory infections in 2003 compared to 1998 to 2002. Now, in 2003, everybody put on masks, pay attention to hand hygiene, and the infections other than SARS actually dropped like a U-shape from March to September. It dropped. All the general practitioners were out of business. After September, there was actually some rebound because there was no more case of SARS, and people actually dropped the infection control measures. So there was some rebound after September. Now, this winter just passed. The winter influenza outbreak only lasted for 5 weeks. And that was because everybody put on masks in preparing for the COVID-19 outbreak. Pay attention to hand hygiene. Now, normally our influenza season normally lasts for 10 to 12 weeks. But in this previous winter season, from January to March, it only lasted for 5 weeks. And that is the result of improved community hygiene. It works.
So mask works here in Hong Kong at least, and it may not be for, because part of the concern has been that in other countries is there's not enough masks. And I remember speaking to Professor Cowling the first week, his advice was saving it for the worst case. In fact, I think his advice was, in some ways, we're all heeding it now because I remember in February, now everybody's wearing masks, and in the U.S., I guess there's just lack of it. And one of my what I hear from Professor Teo too was it just if you use it all the time, running out of masks, and that's something. But right now here in Hong Kong and this region, we're seeing a lot of people jumping on making them. And also, I think one of the advice is even the cloth mask, if not N95, is still better than no mask at all. Do you agree with?
Well, if you can get the usual surgical mask, that will offer the better protection. A cloth mask is not as good, but better than nothing.
Better than nothing. Okay, I'm sending some home to the States later on this week. But one of the questions, going back to the asymptomatic from the online audience, asking, do you have any data giving information about what percentage of cases can be traced back to the asymptomatic sources?
It would be very difficult to study the asymptomatic cases unless your city is actually doing extensive laboratory surveillance. So in Hong Kong, the Department of Health, they are now testing all the returnees from Europe and North America, even though they are free of symptoms. By doing a big study like this, you can actually catch those who are actually positive. So that is why we picked up, 1% returnees through the airport. They are positive on the specimen, but they have no symptoms. And then in the hospital setting, we picked up 12% of cases, confirmed cases. They have no symptoms. Now, if you can isolate them, they don't spread the virus into the community. So you protect your community for as long as possible.
These are two questions from the similar person asking about how safe, and these are questions I've heard as well, and it's great to ask the expert in terms of how safe is it to handle cash, and how long does the virus stay on the cash, and is there any cases of someone infecting that way? And then the other question is also kind of related about using public laundromats, how safe, because of the droplets, how safe, in terms of these kind of daily living issues about the droplets being, on surfaces and on cash.
There was one paper published in New England Journal of Medicine recently from the Rocky Mountain group. So they aerosolized the virus into the environment and see how long it could survive on different surfaces. On plastic and steel surfaces, which do not absorb moisture, the virus can actually survive for between 2 to 3 days. Yeah. If it lands on something that absorbs moisture, like cloth or paper, then the survival time is a lot shorter, like a day or so, or even less.
Okay.
So I guess it is now probably a good idea to use electronic payment. Try not to handle cash. There is no study specifically on this topic, but I think that given the high infectiousness of the virus, it is better to pay electronically rather than handling cash. Because there are always formats that you cannot see.
Right, but also use a lot of sanitizer after using cash.
That's right.
Yes. So I think right now we've been hearing a lot of these death tolls. I mean, I was just reading about, I think the UK numbers in Imperial College. It seems really dire in terms of, the numbers of cases that will globally be infected and then number of deaths. I mean, tell us from your professional opinion, about these numbers. What are you worried about in terms of when you look at these global numbers? What are things that you're particularly paying attention to that kind of alarms you?
Well, really, we are now focusing on the tip of the iceberg. We are focusing on the hospital fatality rate. These are the patients who are sick enough to be admitted to the hospital. So you can have access to the data more easily, right? So looking at China, mortality in hospital is about like 1.4%. And currently in Italy, it is a lot higher, right? Almost 10%. But at the end, we need to look at the whole spectrum to address one question raised by the previous person, right, about the asymptomatic infection. Now, at some point, we need to perform community zero prevalence study. So that means you need to take blood from about 10 to 20,000 people in the community to find out who actually got antibody and yet they have no symptoms. So you try to work out the bottom part of the iceberg. When you know the true denominator, then you can calculate the true case fatality rate. So at the moment, the hospital fatality rate is quite alarming, between 1% to 10% in some other countries. But once you know the bottom part of the iceberg, you have the zero prevalence study data, you know the percentage of people who actually have no or minimal symptoms, and yet they have been infected because they have antibody, then we can actually work out the true case fatality rate. That will be a lot lower compared to the hospital fatality rate.
One other question from the online audience is, for those that get the virus and have their lung infected, is the lung damage permanent and irreversible, or can something be done to repair and heal the lung?
For the time being, about 5% of the patients require intensive care support. About 10 to 15% need to have some supplemental oxygen on the wards. The other 80% are actually very mild. Okay, now for the extreme case that require intensive care support, they would have quite severe pneumonia, and probably will have some residual lung damage with some so-called lung fibrosis. But your body can actually perform some repairs. Now, at the moment, we don't have enough data yet because the virus has spread only for about 3 to 4 months. Okay, so you need to follow up the survivors for a long period of time in order to work out who actually have residual damage. I can give you some example. In 2003, I actually have followed up a large number of survivors up to 2 years. So every 6 months, I perform full lung function test, 6-minute walk, quality of life, etc., up to 2 years. At the end, about 20% of survivors actually had mild degree of impairment of lung function. Now, they are actually quite mild. For ordinary daily activities, you would not know. But if I ask you to chase the bus or walk up an incline, you may become a bit short of breath compared to people of the same age, height, and gender. Okay, so I think at the end, there will be a small percentage of people who had very severe disease that probably will end up with some residual lung damage, lung fibrosis.
One other question from a friend that WhatsApped me this question 2 days ago. In your estimation, how long will this pandemic play out?
I wish I had a crystal ball. I think it will go on for quite some time. At the moment, the number of new cases are still increasing in different parts of the world. Even by June, when we enter the summer season, the virus is supposed to be not so active in summer, right? But then in this southern hemisphere, Australia, New Zealand, it will be winter. The virus would be a lot more active. And then through international travel, it can spread to the northern hemisphere. So I think it may become a seasonal event for a while until some of the population have so-called herd immunity, and also there will be availability of vaccine sometime in 2021 that we can actually get some protection.
So one other question along that line is we have Easter holiday coming up, and traditionally in Hong Kong, Easter is when everybody travels. So it looks like this Easter, even if we are better, the rest of the world is not accepting visitors, so no traveling during Easter time. So when do you think optimistically that Hong Kong, that we can travel again in planning our holidays? Is the summer? I mean, this is a practical question for some of us who are getting kind of cabin fever here in Hong Kong. But obviously, the travel, the global tourism industry is, I know, it's impacted. But in your expert opinion, when do you think just going to Taiwan or Macau or just around Asia, is there a possibility?
So you need to take into account the cases, whether there are new cases being confirmed around your cities. If there are still new cases being confirmed, then you should not travel. In fact, if you stop traveling, that is one way to prevent the spread of infection from one country to another. So I think I have canceled all my trips for this year, I can tell you. I will wait and see what happens next year. All the conferences have been canceled.
Right, all the conferences seem to be gone virtual, like all Zoom conference and so on. So we're going to be seeing each other on the web, online quite often. But how long? How concerned are you personally? Because this is a question from the online audience. We've heard about experts in UK, like Neil Ferguson and Ian Lipkin tested positive, and then of course Prince Charles and Boris Johnson and all that. How concerned are you personally about being infected, and what are you doing because you're exposing to patients and all that, and what are you doing to kind of prevent?
Well, I think it is most important to comply with infection control measures. So in Hong Kong, we have the habit after the outbreak of SARS that whenever we enter any medical ward, even if they are low-risk ward without infectious cases, we would still put on a surgical mask and pay attention to hand hygiene. And then before we enter any high-risk wards, which are accommodating the COVID-19 patients, we upgrade our equipment to N95, put on the eye shield, protective gowns and gloves. If you comply with all the infection control measures, I think you should have no problem. I mean, in 2003, just at the Prince of Wales Hospital where I worked, we actually looked after 327 cases, and I did not get infected. And in retrospect, I even saw the index patient in retrospect, the case that brought the infection from Metropole Hotel to the Prince of Wales. He came in on the 4th of March, 2003. And I was asked to see him on the 10th of March, in retrospect, to decide whether he needed a bronchoscopy. But fortunately, the fever dropped to closer to normal. So I decided not to proceed. I was wearing a surgical mask at the time and put on gloves. He actually infected 138 people just within the first 2 weeks. But my team and myself, we were not infected. So I think if you comply with the infection control measures, you can protect yourselves.
Well, one of the things that I have to say in this, in fact, just reading an editorial in New York Times, and I think somebody is saying the superhero of this for SARS and also this COVID-19 has been really the health workers. And unfortunately, in countries like Italy, they've been bearing the brunt. There's been a lot of fatalities. And even in China as well, there's been, we're seeing this. And so here in Hong Kong, I think we're going to be recognizing our superheroes this Friday night with a really deserved recognition. And so I guess I'm asking this question in some way selfishly because I have a member of my family in the U.S. who is a nurse in the ICU, and they're getting ready. They're in an area where it's not New York, but they're getting ready for. And we, as member of the family, are worried. ICU nurses are high risk, and so it sounds like the only thing you could really advise them is to just be prepared. But doing kind of the measures that you were talking about is really protect yourself because they're going to be part of my understanding is really the exhaustion. Is this nonstop patients that they're seeing. It's not like they can take a break or anything. And even in New York, the universities are graduating some of the doctors NYU early so that they can help be on the front line. And I know Governor Cuomo has been asking some of the health workers from other parts of the world, the country who's not yet seeing it to come and help. So is that something, how do you think China has dealt with it or Hong Kong has dealt with it with these healthcare professionals? I know we've had a lot of experience with SARS. How else can we help? I mean, in these areas, in helping these superheroes, is it by staying home? I know I see the signs of staying home to keep the health worker, but how else can the general public be assisting in this crisis? I feel we're also helpless, and seeing these superheroes going into battle every day. Is it sending them the equipment they need? Is it I definitely giving them the moral support. But what advice do you give for some of us who feel just that there's nothing we can do to help the superheroes on this battle?
I think for the general public, if you can protect yourselves and don't get infected, you are helping the healthcare system already. So to protect yourselves, you comply with infection control measures. So whenever you go for public transport and go to crowded areas, make sure you put on a surgical mask and pay attention to hand hygiene. Try not to go for any mass gathering events. Big group dinner, birthday party, celebration, they should be postponed until it is really safe. We don't really need to send masks unless you know that they are actually of certain standard. Now, there are some N95 masks, different brand number. One type is only for construction site workers. They're also N95.
I have a few of those because those are the only one I can buy in the
So
U.S.
we have received some donation of N95 that are more suitable for the construction site workers. They are good in blocking silica, but not for virus infection. So unless you know you are sending the right brand, otherwise I think you just protect yourselves and stay at home as much as possible. Try to avoid mass gathering.
Well, this is another question from the audience online about comparing South Korea and Germany's fatality rates. The two countries are also dealing with it quite differently. So can you tell us, in your opinion, how South Korea is handling this current crisis in terms of the testings, and they seem to have done a good job in the testing, and what you know of what South Korea has done?
Now, South Korea, they actually had undergone a major outbreak of MERS-CoV in 2015. So one of the businessmen actually went to 4 countries in the Middle East and took the infection to South Korea. At that time, they were taken by surprise. They had a major hospital outbreak leading to 186 cases. The wards were very crowded. The healthcare workers were ill-prepared. They did not comply with infection control measures. And at that time, they had shortage of nurses. They even allow home carers. One person can take home carers, and they stay in the hospital to care for the patients. So you can imagine the overcrowding, So I was actually on the WHO mission to South Korea in 2015, and we made a lot of recommendations, They need to build more isolation rooms. They need to avoid overcrowding of the wards, improve ventilation. And they need to stop the culture of bringing in relatives and friends to care for the patients. And they also had the habit of the doctor shopping at that time. So if you don't like the hospital, you can change to another one in a day or 2. So one patient can actually move to 4 places within a week, So they actually spread the infection laterally across the hospitals. So all this culture has been changed since the outbreak of MERS-CoV in 2015. So they have built more isolation rooms in between, and the healthcare workers, they are much better prepared. So after the major outbreaks in 3 zones, they did very extensive laboratory surveillance. They tried to pick up those who are positive and isolate them early. And they also quarantine a lot of close contacts, very similar to Hong Kong. So I think they are now controlling the outbreak quite smoothly now.
So I think in what you're saying in this is experience counts. And I just remember coming back to Hong Kong in 2003, living in New York, and coming back every year, seeing the elevator panels all continue to be sanitized, even after SARS. To this day, almost every major hotel, that sanitation, just in terms of the cultural differences, like you said, it changed after SARS here in Hong Kong, and it maintained. So in some ways, we have, in Hong Kong, the 17 years, some of the habits that we developed SARS has really kind of helped us in this current crisis compared to the other countries who have never really seen it. And I remember seeing Ebola in the States. There's been pockets of these, whether it's Ebola or Zika and all that, but it didn't, right now we're seeing a global pandemic, which we've never seen before. I guess the closest one is really the Spanish flu in 1918. So I think this will help change habits and maybe make us even better prepare, I guess, for the next whatever that comes. But from your experience in terms of all of these viruses and all that, I guess this is probably the biggest one that has affected everyone, correct?
Yep, this is also the first coronavirus that has ever led to a pandemic. Previously, we had influenza, right? In 2009, we had the H1N1 swine flu, and this is the only coronavirus leading to a pandemic. So it's very special.
And I know we're going to get a lot of wonderful data and information and learning experience out of this. But one other question also from online asking, why didn't the government here in Hong Kong quarantine everyone coming from the U.S. and Europe, at least by 1st of March, when it was clear that the pandemic was exploding there? Did we know that it was exploding?
I think the number of cases was increasing, yeah. I think the government introduced the compulsory home quarantine only on the 19th of March. Yeah, they need to have some laws and rules being passed by the Legislative Council, I guess, or at least internally. So I think it would have been better, of course, if we had introduced the compulsory quarantine a lot earlier. Yeah, and as a result, a lot of people actually rushed back before the 19th of March. And from what I have heard, between 12th and 18th of March, at least 70,000 people came back. These people did not need to undergo home quarantine, and they were free to move around in the community. And I'm sure some of them actually carried the virus and actually introduced the virus into the community. So after the middle of March, we saw an upsurge in the number of cases. And most of them were actually from returnees, and some were local outbreaks caused by them.
This is anecdotal, but there's somebody that I know who is who returned from U.S. to Singapore, and she's currently being quarantined at a hotel near the airport or somewhere. And it seems to me, is Singapore also imposing that quarantine on returnees?
Yes, Singapore, Taiwan, actually many countries are doing the same thing. If you want to stop international travel by having this sort of administrative measure.
And I guess 2 days ago, listening to the chief executive's briefing, she seemed more optimistic about the efforts that has been kind of carried forward this last week. I guess one of the things that I also learned from about 2 or 3 weeks ago in talking to some of our experts is this complacency. So what do you advise some of us here now in Hong Kong and also globally, this complacency? I mean, we really thought, I have to say, about a month ago, thought we were out of the woods here in Hong Kong, thinking that when we were having 200 cases compared to, and the world was seeing the explosion. So what's your advice on the complacency? Should we still keep our eyes on the ball for this pandemic? I mean, even though, relatively speaking, compared to the rest of the world, where our numbers are not as high, but like you said before, our growth, we've quadrupled in this last 2 or 3 weeks. So what's your advice to our own government here in Hong Kong, to the public, but also to the global audience? Is it?
Well, with the increasing number of cases almost everywhere, we need to stay vigilant. You need to continue the infection control measures in your home city, where appropriate. In Hong Kong, we would continue the containment measures. Try to isolate the suspected case, confirmed cases, quarantine all the close contacts. You do it as far as you can to prevent the spread into the community. And we would continue the social distancing measures. And I can imagine that initially these social distancing measures on the restaurants, etc., are supposed to last for 14 days. I think there is a good chance that it will be extended for a bit further, because we are still seeing increasing number of cases and some community outbreaks. Yeah,
I see. And right now, yesterday, we also heard the case about a baby who contracted the virus, but her parents were actually tested negative, so she didn't get it from her parents. Apparently, the baby got it from a baby shower from relatives or friends. So right now, some of the myth was that it doesn't affect young people. Can you kind of address some of that about the young people? A lot of young people seem to think they're immune to this.
No, the young people, they are not immune, but if they acquire the infection, the clinical illness tend to be more mild compared to the adults. They don't have the so-called cytokine storm. Whereas in the adults, the virus can trigger some cytokine dysregulation in your body, and the cytokines attack the lungs and other organs. But in the children, they probably don't have a very mature immune system to trigger this damage. So they tend to have mild disease.
Can you, you also were one of the first to be invited to China, I guess, or a few months ago to see some of the development in Guangzhou. Are you confident, right now we hear Wuhan and Hubei, they're going to be lifting their, I guess they're going to be coming out of their confinement on the 8th coming up. But then yesterday we also heard cases in Henan, one of the counties is they're doing a lockdown. So there seems to be kind of good news, and then but also and I think even travelers going to Beijing are kind of international travelers. The government is also doing measures to discourage them, to discourage foreign travelers coming into China. So looking at what China, and in some ways people have given China a lot of credit for dealing with this as effectively, as quickly as they have. So what do you think are the lessons that think the world can take from what China has done, but what yourself has observed when you were on your fact-finding trip a few months ago in southern China?
Well, I went to Guangzhou on the third day of Chinese New Year. That was about 26th of January. I was there only for 1 day, helping Professor Nan Shanzhong to go through some data, looking at the clinical features of COVID-19. Now, when I went there, the city was extremely quiet. That was Chinese New Year. Normally, the restaurants would have opened, a lot of people in the streets, but they had a lockdown. So I think that happened in most provinces in the mainland. People were trying to stay indoor. Okay, I think it was really strict in Hubei and when Wuhan, people were not allowed to leave home, and they were only allowed to go downstairs to pick up the groceries delivered by the government officials twice a week. So with a very tight lockdown for 2 months, they managed to control the spread of the disease. So they are now thinking of normalizing the activities from April, gradually in different provinces. Now, however, we have to be careful because I believe there may still be some community cases that may not have symptoms or mild symptoms. So we just have to watch out for any second wave from occurring.
I think we're running out of time. We only have about 3 minutes left, but I just want to give you this opportunity to some closing thoughts, about what are we, I guess more advice for the people here in Hong Kong as well as globally. Would continue, I guess, is continue the social distancing, keep the spirit. But what are some of the advice that you would give us right now in terms of tackling? I mean, we've come through, I feel Hong Kong really this last 2 months and 3 months, and so so what do we look forward to, and any positive advice for Hong Kong?
Well, I think we have been implementing the containment measures since January. I can understand that there is some fatigue, in the local population. People tend to go out a bit more in the last few weeks. In early February, most of the restaurants were quite empty. But in recent weeks, I can see some queues in some of the restaurants. So I think we have to be careful. I mean, if you want to go out for dinner, okay, well, just follow the government advice. Don't go, which table can only accommodate 4 people, right? Before eating, after eating, when you are chatting, put on the mask. Take it off when you eat, but put it back when you finish. Pay attention to hand hygiene, and the tables are actually separated by at least 1.5 meters, right? So make sure you comply with the infection control measures. Maybe go out to the countryside during weekend for some walk, but don't crowd together.
Good advice. Good advice, Professor Hui. We really are grateful to you and all of the wonderful healthcare professionals, and your opinion, your years of experience is really helpful, and really is something that in Hong Kong that it's really needed at this time, and you've been working advising WHO and it's something that I think experience really is something that cannot be replaced, and we're really grateful for you taking your time from your busy schedule to be with us. And I continue to read coverage from the government and from quotes from you, and really following the advice about what to do with this COVID-19. I think we are really in this together, and it is not something that when we first started this broadcast, thinking that it's it's a Hong Kong issue, but as we can see, it's become really a global issue and global pandemic, and we are really need to be there to help each other through this crisis. And it doesn't seem like there's a definite timeline yet, but I think we shall overcome, as the song says. And thanks to technology, that we can bring you this type of broadcast, and whether it's Zoom or other way of communicating, I find myself reaching out to friends and family, people I have not heard from in years, just to make sure everybody's okay. So there are ways. In fact, listening to Professor Hokuda just a while ago, I think social distancing does not have to be the end of social cohesion. I think we can still be together in this together, and I really want to thank again all the healthcare professionals here in Hong Kong as well as in the world. Thank you for your great work and your dedication. Without that, I think we would not be, we would not be safe. So thank to all of that. So continue tomorrow. Tomorrow, we're really excited to get, this week we have 2 Corona updates back to back. And tomorrow, episode 9, we're really grateful for Professor Gabriel Leung from Hong Kong University, who will be with us also at 9:30 Friday morning, Hong Kong time. And please join us then. And also next week, we're really delighted. Dr. Jessica Manning will join us on Thursday at 10:30, and she will tell us more about what's happening in Southeast Asia, where she's based, about how they're tackling the COVID-19. And so keep on watching here and at asiasociety.org. And we have all the updated information from globally, all of our centers. And it's times like this, I wish all of you health and stay vigilant because it looks like we're going to be here talking about this issue for a while. But knowledge is power, and also shedding light, not heat, is really the model of Asia Society. So thank you. Good morning.